Now we move into the second and final part of today's hui. And of course, we have all experienced, not just here in Aotearoa, but also around the world, the devastating impact of COVID-19. It definitely influenced and shaped the way that we engage with each other, the way that we, as has been mentioned today, process and manage information, but also the way that many New Zealanders and also the government are having to balance surveillance versus keeping our citizens safe. So this morning, we're just going to kick off with a kōrero from Ashley. And I just want to acknowledge Ashley because throughout it all, he was pretty much our constant touching base, connecting with us and trying to at least allay concerns of New Zealanders. But one of the beautiful things I firmly believe is openness and transparency is important for all of us to feel safe. And the role of privacy in this particular time helps us to feel safe, certain and secure. But the panellists today are going to bring some interesting layers to what does this mean and what does COVID-19 mean to us as Māori, across the Ministry of Health and also as researchers. So without further ado, let's listen to Dr. Ashley beam in from wherever he is in the world and give us his aroha from his heart to us. Kia ora.
Kia ora koutou katoa, ko Ashley Bloomfield toku ingoa. Thanks very much for the opportunity to speak to all of you who are at the Privacy Forum this week. And I'm apologising for not being able to be there in person, but you've got one of our very senior people, Shayne Hunter, there as part of the panel following this address. So I look forward to hearing back from Shayne, and I know he will contribute enormously to the discussion. I want to just reflect to you some of the lessons on what I call life and leadership from COVID-19 over the last year and a bit that I've been teasing out and talking about with a range of audiences, and I will give that a bit of a flavour around privacy and some of the bits of work we've been doing that you've contributed to, or certainly the Office of the Privacy Commissioner, but also where we've had to be very agile and adapt and change the way we've done things in very rapid time. So perhaps just to reflect on a few of those and some of the lessons from that as well. So clearly, when a pandemic comes along, suddenly everything changes. And one of the things that changed in particular was that things that we had been doing on relatively slow or perhaps in a measured way, we had to rapidly increase delivery on. And we also had to develop new tools, new ways of doing things that we previously hadn't even envisaged. Some of the examples that come to mind are the development of the NZ COVID Tracer app, the establishment and ongoing development of our contact tracing solution, our national contact tracing solution. More recently, of course, the development of our COVID immunisation register. Those are just three examples, but ones that at the beginning of 2020 were not even really on our radar. In fact, they weren't on our radar. So we had to do a lot of very rapid work. And of course, as part of that work, we had to engage with the Office of the Privacy Commissioner and move very quickly through a careful and complete consideration of all those privacy issues. So it was wonderful to be able to leverage the relationships that our team here, our data and digital team and our security team here had established with the Privacy Commissioner to make sure we were covering off those issues and that we were able to address any concerns in a very quick time. If I reflect back on 2020, again going back to the start of the pandemic, and one of the things about a pandemic is that very little is in your control. Things are happening so rapidly. There's an emerging situation. Most of that is happening overseas, and there's a real lack of information about just what's going on. So it's the classic leadership challenge of having to advise on or indeed make big decisions in a short space of time, but with very incomplete information. And so one of the things I think that serves us very well in that sort of situation in New Zealand, and we've seen this before in the response to other more local emergencies like the Christchurch earthquakes, the Whakaari White Island eruption, more recently the Kaikoura earthquake as well, that the public service in New Zealand, the wider public service, because of the way we work in a very open and transparent way, and because of the relationships that tend to underpin our work, we're able to draw on that very rapidly to be agile, to be very responsive. I think we saw this again in COVID, in the COVID response. And for me, in the role I was in and remain in, particularly in those early days, that ability to reach out and seek support from or information from a whole range of colleagues across the public service, across the health system, and indeed out into communities was fundamental to us being able to mount a really rapid and, as we've seen, actually very successful response. Successful in the sense of actually protecting the health and well-being of New Zealanders first and foremost, as well as it's transpired, protecting our economy from some of the shocks that might have happened if we hadn't followed the route we have. So one of the things that became really apparent to me early on in the response to the pandemic was, because things were moving at such rapid speed, I couldn't possibly be, as the leader in this organisation, I couldn't possibly be across the full range of activities and actions that needed to happen, let alone across the wider health system. So I became, as I am every day, I guess, very reliant on people having a good understanding of what our collective sense of purpose is, and then acting on that. So within their own area of work, seeing what needed to be done and just getting on and doing it. And I think there's no area where this was more obvious to me than in the area of the developments in our digital systems. And I've talked about a couple of examples, the NZ COVID Tracer app, and I'm particularly proud of the work around our contact tracing solution here, where a couple of teams in the ministry sat down, saw what needed to be done. No one asked them to do it, actually. They saw what needed to be done. They recognised we had a huge gap in New Zealand where our contact tracing systems were local. They were very rudimentary in most public health units, often paper-based or just spreadsheet-based in most public health units. So they saw a huge gap there in the need for a national approach to this and a national solution to this. And they stood up, really in the space of about a week, a potential information system that could underpin contact tracing nationally. And they've developed it from there. I think we're now on probably our 23rd or 24th iteration of that approach. And of course, a key part of developing that system was also recognising what the privacy issues might be, and in particular where you've got quite sensitive clinical information about people, of course, what we're used to dealing with in the health system. And one of the features of that national contact tracing system is that it allows us to share work across the ministry and across all our public health units. So if, for example, there's an outbreak in Auckland, where we've seen virtually all of our recent outbreaks, they're able to share the work with other public health units across the country, and likewise our team in the ministry can do that work. But some really important privacy issues that need to be considered and worked through to ensure that people's information is being treated with respect, and of course where it's only shared really where it needs to be shared. So I'm very proud of the work that our teams have done to develop up those solutions really that have absolutely underpinned our successful response. Same thing happening again over recent months with our COVID immunisation register, where we've had to absolutely expedite that work, something which of course we knew we would need to update our national immunisation register, but it was on a much slower, more measured time frame. That work's needed to happen apace. And again, I want to thank those of you in the Office of the Privacy Commissioner for the support you've provided and for your turnaround of our requests and your willingness to, time after time, work with us on assessing and addressing any privacy concerns. So one of the other big, a couple of other lessons for me from 2020, and these are more general things, and I just hope that perhaps they provide something of value and of interest for you as you think about your work, and also maybe something that can lead into the panel discussion as well. That when you're in that sort of situation where the context is very difficult to control, we talk in leadership terms about the three leadership responsibilities: leading self, leading others, and leading context. And of course, when there's a 1 in 100 year global pandemic, not surprisingly, it's pretty hard to lead the context. So often it will come back to really how do we lead ourselves through that? And one of the things I've been reflecting on from the last year is the importance when everything in your context is beyond your control to make sure you don't give away the things that you can control. And of course, we can always control our behaviours. We can always control how we think about situations and issues and how we respond to those. And our behaviours are of course anchored in our values. And so the values that I've been thinking about as so important to my personal contribution and response over the last year and a bit through the COVID-19 pandemic, those key values I've been thinking about have been kindness, compassion, which is of course such an important part of our work in the healthcare system, the value of curiosity, of being prepared to always think about, well, what else is going on here? What other information do we need? And also the value of humility. And perhaps just to touch on that latter one, this has really come home to me, is the importance of, as a leader, leading with humility to me is about being prepared to listen, being prepared to ask others for advice, being prepared to say when we don't know, and of course to say when we've got it wrong and what we're going to do to fix it. And I've had to face situations often on live television at 1 o'clock pretty much every day for a period there, where I've had a range of reporters with a number of examples of where they need to point out to me where either things didn't go right or indeed where there are gaps in our information. The interesting thing, of course, here is that, and I've had this feedback from members of the public, many of whom still on a daily basis come up to me to thank me and to thank the Ministry of Health and the Public Service for the work we've done to keep them safe. But the interesting point that people make is that why they trusted our response, and in particular when the Prime Minister asked New Zealanders to do something quite extraordinary, hadn't been an experience in anyone's lifetime, which was basically to go home and stay at home to look after each other, to protect each other. And people understood why she was wanting them to do that, because we had communicated openly and transparently. And we had been prepared to say we don't know. We had been prepared to say, actually, that didn't go right, or yes, we got that wrong, or we've changed our minds because actually we've got new information or new evidence. And it was our being prepared to lead with humility, to not have all the answers, to not pretend we had all the answers, that actually built people's trust. And of course, trust in government and trust in our healthcare system is so fundamental, and our people's confidence that we're going to keep their information private is a really important part of that trust as well. Again, I've talked with clinicians about the importance of this lesson about being prepared to say, actually, we don't have all the answers, we don't know, because in our interactions with patients and with family and whānau in that clinical situation, it's really important that we build their trust. The other thing that was really apparent to me, and I've just touched on this, is when the Prime Minister asked New Zealanders to, as I say, go home, stay home, and that was the 21st of March, there were very few people who said, well, why? Why are you asking us to do that? And I've talked about the sort of 6 to 7 weeks we had to inform people about what was going on, to update them regularly, to be open and transparent about what was going on and building that trust. So that again, when the Prime Minister said, I need you to go home, we need to stay home, save lives, be kind, and it was quite a powerful call to action in my mind. But again, people didn't say why, because they knew why. We had been open and transparent. We had brought them in. They understood what was needed, what needed to be done, what our collective sense of purpose was. And I think there's a great leadership lesson in this. All too often we spend too much of our time talking with people about the what and the how. If they understand the why, they actually know or will work out the what and the how. And we saw communities doing this all around the country. We saw iwi Māori among the first in our communities to recognise what was going on and to take action to protect their kaumātua, to protect their communities from COVID-19, because they understood from what had happened 100 years ago, and it was fresh in their minds. They understood what might happen if they didn't take action. So I think there's a real leadership lesson for us as individuals, and for those of you in leadership roles in particular, that actually if people understand why, they will work out, or they know the what and how, and we can spend a bit less time on that. And going back to the example I spoke to earlier about our national contact tracing solution, actually it's a fantastic example of the teams here in the ministry just understanding the why, and then sitting down and working out the what and the how. No one needed to ask them to do it. They saw what needed to be done and they went on and did it. And my great hope is, of course, as we move through 2021, where this threat, which is not apparent to us in New Zealand on a daily basis, but is very, very real in many other countries, that this threat continues to, I guess, unite us in our collective action to keep the virus out of New Zealand, but also to think about how we can protect ourselves and protect others, to continue to protect our vulnerable communities by being vaccinated. And of course, we're doing we've got a huge effort underway to deliver that COVID-19 vaccination program to New Zealanders. A key part of that is our communication around it. And we only have to look back last year as to the point is about how we should communicate consistently, clearly, transparently, and through a range of channels. And be prepared to say, we don't know. Be prepared to say, actually, we've changed our mind because we have got more information. And people will trust us, and they will trust the program, and they will trust that it is the right thing for them to do, to be vaccinated. So I think that's about all I want to say. I just want to finish by coming back to one of the values I talked about, which is the value of kindness. And you'll see that crossover with the call to action that the Prime Minister made on the 21st of March last year, and that I think saw us through in fantastic shape through that period of lockdown, that call to action to stay home, save lives, be kind. And of course, most New Zealanders knew that they weren't staying home to save their own lives. They were staying home to save the life of their elderly parent or neighbour, of their disabled friend. They were staying home because they knew that if COVID-19 got into our community, it would have a much greater impact on our Māori and Pacific communities. And so New Zealanders decided to stay home to actually protect not just themselves, but to protect others. And that call to action to be kind was, I think, a really important one. It's a very different message from stay home and look after yourselves. So in the midst of our response last year, we saw the impact of people acting collectively in each other's interests. And we set out at the start of that lockdown period to try and suppress the growth, to try and bend the curve, to get the numbers of COVID-19 cases down to a level we felt we could manage. And it became apparent after 10 or 14 days that actually New Zealanders had embraced that opportunity, that invitation to collective action so willingly and so fulsomely, that actually we were in a position to be able to get rid of the virus in our community, to prevent, to cut off chains of transmission and to eliminate it. And from that was born our elimination strategy. And that's the approach we've taken since, where we do get an incursion or might get an incursion through the border, that actually we won't tolerate the virus in our community, and we'll set out to take deliberate steps to eliminate it once again. And so I would like to commend that value of kindness to you, and also just to remind you in your work, and I know you'll have all been working hard over this last year in a time of uncertainty, a time when both professionally and in our personal lives there have been things we've had to navigate that we never thought we might have to. Just encourage you, of course, also to be kind to yourselves. It's hard to be kind to others if you're not being kind to yourselves. And so look after your own well-being too, and make sure you recognise that resilience is not about keeping going. It's about knowing what our boundaries are, what our physical and mental boundaries are, and taking active steps to stay within those boundaries. So final word, just to wrap up again, to thank you once again for the work you've done to support our work and the broader work that has been New Zealand's successful response to COVID-19 to what is a 1 in 100 year pandemic, the biggest global health threat in 100 years. And that our work, of course, is not finished. And also, as was announced by the government a couple of weeks ago, we're moving into a period too where our health care system will be undergoing change, where some of those key enablers of our future healthcare system will be an expanded role for data and digital, and that will require input, more input as well around privacy and around making sure that we are protecting individuals' information so that we can maintain and continue to build New Zealanders' trust and confidence in our healthcare system. So thank you again. I'll look forward to hearing from Shayne how the subsequent panel discussion goes, and I wish you all the best for the rest of the day. Kia ora.
Dr. Ashley Bloomfield, the Director General of Health, and as I said, was a constant touch point for all of us at those 1 o'clock briefing meetings. And I appreciate that he did mention that he was taken to task quite often by reporters, particularly when they possibly didn't make the right choice at the time. Now, just coming to the stage, I'm now going to be joined by Dr. Tahu Kukutai from the National Institute of Demographic and Economic Analysis, Dr. Andrew Chen from the University of Auckland, and I'm hoping that Shayne is here too. Oh, kia ora, Shayne. Kia ora, come to the stage. Ho mai te paki whānau. Hi, just checking. Oh, great. Awesome. So thank you all for coming to the stage today, and it's really awesome to have your unique perspectives to help us think broadly about privacy and COVID-19. There are a series of questions that have come through Slido, and also there are some questions that we've already got in our hands to help ignite discussion. So hope everybody's okay. What I'd like to do is I'd like to ask you, each of you, to please just give us a brief introduction of yourselves and also the role that you have played in regards to New Zealand's fight against COVID-19 and New Zealanders as well. So tēnā koe Tahu.
Tēnā koutou katoa, ko te mea tuatahi e mihi kauana ki te mana whenua o tuahi nei, ko kia te Aotearoa, Taranaki whānui me Ngāti Toa Rangatira. Ngā mihi ki a koe te kai hautu o te hui nei, me te rangatira John, tēnā koe. So kia ora everyone, I'm Tahu Kukutai. Gosh, have I contributed to the fight of COVID-19? I stayed at home.
Good on you.
I suppose just to sort of, put myself in context. So my day job was a demography professor at the University of Waikato, but like many Māori academics, I wear multiple pōtai. Probably the one most germane to the kaupapa of today is a founding member of Te Mana Rārunga, which is the Māori Data Sovereignty Network, and the Global Indigenous Data Alliance, which is a network of networks that works in an international context. And basically what we advocate for is for Māori and Indigenous rights and data. So it's that lens that I bring into the discussion today. And I'm also a technical advisor to the Iwi Chairs Forum, Data Iwi Leadership Group that works with the Ministry of Health and with Shayne. Although, I often find myself as the only Māori on many panels and boards. So I'm not here to represent. These little shoulders do not carry the views of Te Ao Māori on them. So I'm just here as one person, bringing perspectives from a variety of places that I've been in. So the key concern of Indigenous data sovereignty is really about the locus of power. And where is that situated? So it gives rise to issues such as data control, data ownership, trust, and privacy. And so I suppose in this context, and we'll have a chance to talk about this more, I hope, is what does Indigenous data sovereignty bring to the conversation of privacy? And I think there's three, just from kind of mulling over some of the discourse that we've had already, which has been really full and lively. I've enjoyed it so much. Three very brief insights. One is around how do we scope privacy? Regulatory frameworks, discourse and approaches to privacy are all built on this idea of the individual, about personal and individual data rights and protection. I think this is wrong-headed. I think it limits the scope of our understanding of privacy rights and establishing protections. And in a context, a global universe, which is we're seeing the exponential datafication, which is the transformation of our lives into data and then into information, which realises a secondary value. We need to think broadly about privacy, not narrowly. The second one I think would be around, just as we've seen the commodification of data as the world's most valuable resource, and we've had the previous panel talked about that. The commodification of data, I think we also run the risk of commodifying privacy. And so seeing privacy as something to be a trade-off, and who decides what those trade-offs are and what they look like. And I guess the third point I would make is around context, and this isn't just around privacy, but it's sort of around policy and regulatory frameworks. Writ large, is a sort of a tendency to look at other countries and see what their regulatory environment looks like and then transport that best practice into our own context. I think there are risks with doing that. Privacy, like anything else, is contextual. And yes, there are lessons we can learn, but Aotearoa has its own specific history. We have our pre-existing tikanga, kawa, and knowledge systems. Why can't we look at a privacy approach which is Aotearoa fit for purpose? And I'll leave it there.
Kia ora. Awesome, really, really important points, and I'm certain we're going to flesh that out in our panel today. And some really helpful challenges, I feel, to really help us broaden the scope and the idea around privacy, individual, and also what are the considerations for the collective and what does it actually look like. So excellent points, Tahu. Andrew, sure. You've been doing some pretty cool things in technology and COVID, but also as a representative of Auckland University. The university itself has been involved in research, producing some great advice globally around public health, also plays a role in overseeing the vaccination rollout and different technologies in that space. But I understand you've got a specific focus on surveillance. Could you please talk to us a bit about your role and your role in the COVID-19
Sure. Tēnā koutou katoa, ko Andrew Chen toku ingoa. He paiwai rangahau aho, paiwai rangahau aho, I koetu I te tamaki makaurau, te wharewananga o tamaki makaurau, kia ora mai tātou.
Kia ora.
Thank you. So I'm a technologist by training, but I sort of went sideways into digital technology and ethics as a research area. And when sort of COVID hit, my background in developing surveillance systems that I did not like doing sort of kicked in because contact tracing is a form of surveillance. It may not be as creepy or as scary as CCTV, sort of facial recognition surveillance, but knowing where people are and where they've been going and who they've been talking to is a form of surveillance. And so I was involved in trying to bring that lens into the contact tracing discussion, particularly looking at how others were trying to do it overseas as well and how we could adapt that into the New Zealand context. Similar to Tahu, I can't bear the weight of all of the University of Auckland on my shoulders. There are lots of researchers doing really great things. Immunisation Advisory Centre is doing a lot right now, trying to train up vaccinators. The work of Te Matatini has been awesome in trying to get modelling out there, do science communication. I just played a very, very small part in looking at NZ COVID Tracer, what it does, how it could be communicated better, what features should be added to it, and trying to draw from global evidence. And I think one of the observations that I just wanted to share was that the design choices and considerations that were exercised really early on in the pandemic, when we look at it globally, we can see a really wide variety of choices that were made. And why was that? Because contact tracing, digital contact tracing, using digital technology to help us with contact tracing, is essentially an experiment. Prior to COVID-19, there were a total of 6 papers that had done any form of digital contact tracing, and they were all in hospital or school settings. Nothing at a national level, nothing that had actually properly considered the privacy aspects or how this might integrate into a national health system. So digital contact tracing is something that logically kind of makes sense, but it was ultimately unproven at the beginning of the pandemic. And governments had to make really, really quick choices about how they were going to design these systems. And so if you wanted perfect contact tracing, you would build a massive database of every single person in a country and exactly where they've been and who they've talked to at every single possible point in time. And then if somebody gets COVID-19, you go look them up in the database, you find all the people that they've talked to, and you isolate them. And we could have gone down that path. We could have made everybody download an app using GPS to track people and their movements and stored it all in a centralised database. And there was actually a government that did this, and it may not be one that you expect. It was Norway. And it was a couple of weeks or months afterwards that Norway's data protection agency said, actually, that was inappropriate and you probably shouldn't have done it. And so they stopped. And they stopped using that app and they switched to a different one a little bit later on. And so with the benefit of sort of hindsight, you look back at that and you look at the choices that a lot of governments made, and you look at that and you go, yeah, New Zealand actually probably made some decent choices early on. We have a decentralised architecture, so the data stays on the device rather than going to a central server. A lot of governments overseas, they started with a centralised approach, and then people weren't using the app, and they had to switch to the decentralised one. We started with QR codes, everyone else started with Bluetooth. Now we're seeing, we were a little bit late to Bluetooth in December, but a lot of other governments are now adopting QR codes as well. And so, I think it has been a really interesting natural experiment to observe, and there's a lot for us to learn from that, so that in the future, if we want to use technology to help us with these sorts of processes, we can make sure we get it right the first time. Kia ora.
Kia ora. And Shayne, from the Ministry of Health, I hear that Ashley will be listening carefully for your feedback on today's panel, so let's make sure we do a good job. Can you tell us, please, your role in the Ministry overseeing and supporting the government's response to COVID-19?
Kia ora koutou, yes, Shayne Hunter. You got Ashley. I was going to say God. Ashley is a bit of a god, actually, and he probably is listening. It's been a hell of a privilege, to be frank, working with Ashley and working with the team at the Ministry and working with the public health system and with a range of organisations, including the Office of the Privacy Commissioner and stuff through COVID. Let me go back. I've got quite a large team of people. We're responsible for all of the national collections in New Zealand. We're responsible for all of our national systems for screening. We have quite a significant responsibility for protecting data. I first got involved in health in about 1998, and I arrived having done some work at ACC on what was then known as the Health Intranet Governance Board, and literally arrived and found out that the health system takes privacy very seriously. That network was actually set up to protect information, and so I've been immersed in the concept, I guess, of privacy of health information since 1998. When it comes to COVID, in terms of my responsibilities, I was actually thrown at supply chain for a little while. Ashley said to me, said to the exec, we're going to have to divide up the responsibilities across this pandemic, and Shayne, you're the only one that knows about the supply chain, so that's your job. So that was swabs, test reagent, for lab testing, ventilators, oxygen, critical supplies. So for the first probably 8 to 9 weeks, that was my responsibility to set up a team and make sure that we actually had access to that. And I left my team to it with a few instructions of what I needed them to do. And I'm incredibly proud of my team because we've probably put in about 15 or so different systems through COVID. And we've had to make decisions at speed. We've been actively involved with the Privacy Commission right through, and one of the lessons that we need to take forward is to always engage early. And I think generally we did, and we got great support. But I said to them, look, we're going to go up to this thing called level 4, which levels weren't even known about to start with, to be frank. And at that level, we're going to have huge social license, but we have to remember that we're going to come down to level 1, and then ultimately we'll be out of it. And then we'll be judged on the decisions we made around the way that we protected information. So that's the first thing. The second thing is get clear on the problem, because we are going to get inundated with the most interesting technology solutions that are going to save the planet. And some of them are going to be untested, unproven, and we need to be really, really sure that there is in fact a need for a technical solution, because it's very easy to go to technology, but it's not always the solution. So get really clear on the problem and make sure that we prioritise and we focus on the right things. The third thing we agreed with him was just we've got to leverage this. This is a once-in-a-lifetime opportunity. And you will have heard Ashley talk about how little we actually had to start with. I think globally, not just in New Zealand, it's not a case of underinvesting in public health, it's been actively divesting in public health. And we got caught short. Globally, we got caught short. And my view was that we will probably never get this money again, so we better spend it wisely, and we better make sure we get some leverage out of this going forward. So spend it wisely. And the last thing was inclusion. We need to make sure that as we do roll out these digital solutions, we've got a solution to ensure those people that don't have ready access have a way to access. So one of the first things we did early was to put something in place called sponsored data, which essentially said if you've got particularly if you're on a prepaid data plan or on a limited data plan, then when you access certain systems in the health system or websites, then they're no charge. They don't draw down on data. That was one of the early things that we did, and then we did a number of other things to look at that as well. So, and I left the team to it for 8 weeks or 9 weeks or so, and when I came back, a whole bunch of things had just popped out of nowhere. It was quite impressive, and the big thing for me was we would typically do, a year-long exercise in designing something, a year-long exercise in building it. And then we'd run out of money, and then you'd have to live with what version 1 was, and if we got more money, you might get version 2. In 12 months, we iterated on the national contact tracing system that Ashley referred to 21 times. So we started with something minimal, and then we just built out from there. And then we were constantly having to review our privacy settings as we went through, as we added new functionality. So, I'm really proud of what the team did, and I'm very proud of the fact that they stuck to the principles around, privacy first and security. So that's our contribution.
It's a massive responsibility. Do you feel, now that you look back, it's a year later, and you say, hey, look, we'll do things and then we'll apologise later. Have you found that you've had to apologise for things that have taken place over the past 12 months?
I think we've been involved in a few things where apologies have had to be given. I mean, one of the things that we found ourselves really early on was this pressure to share data. And we put in place some processes to share data. We had some other parties that were a little irresponsible with that data, and so we found ourselves having to deal with the fallout of that. Commissioner, I remember reviewing one of those. So we had to mea culpa on that one. That was one of those things. And I think more importantly, the lesson out of that was we did the right thing at the time, but we didn't review it. And so we didn't go and basically decide at what point do we need to stop doing this. So yeah, we've learnt a lot on the way. I think generally speaking, I feel that we've got it right, but we've had the odd slip, yeah.
Kia ora. Now, Andrew, this is a really important question in regards to surveillance, because what I heard you say was the issues, the challenges around surveilling the public, especially with these gadgets that we have in our hand or our phones, alongside the intent of public good and protection. What was the advisory or thoughts that you were putting into this space around how do you balance out the government's need to protect its citizens, but also not unfairly surveil or be overly involved in the lives of New Zealanders?
Yeah, I think that there's two things to note. So firstly is that there is an overarching principle of proportionality. And so when there is a significant harm that can accrue, like a global pandemic, then proportional actions should be taken to mitigate that harm. And if that means you have to infringe upon some rights, then you need to infringe on those in a proportional way. And so collecting information for the purposes of contact tracing so that you can mitigate the harms of a global pandemic is probably well justified in terms of proportionality. But I think proportionality is something that is constantly changing. It's not static at one point in time. And so the collection of information about individuals, even if that's staying on your own device, is an infringement upon your privacy rights that is currently well justified. At some point in the future, it will no longer be justified. And we need to constantly keep testing that proportionality to make sure that we are going to turn off these systems when they are no longer needed. Governments around the world have basically said, we'll turn these systems off when the pandemic ends, but there is no firm definition for when the pandemic ends. And I think that's something that I would like people to think about when they've got some time to think about that. The other point is that it is natural for us to view public health and privacy as being dichotomous rights, as sort of you need to trade off privacy in order to get public health. But I actually think that those two should be advanced together, because one of the really key parts of public health is compliance. You need people to do what you need them to do in order to protect public health. People will not be compliant if they don't trust. People don't trust if they don't have a sense of privacy. And I think we saw this in some of the cases in Auckland in February. If you know that the Ministry of Health is going to tell the whole country about where you've been, then of course you might not tell them about every single place that you've been. If you know that the Ministry of Health is going to tell the whole country about you and your family and all of your interactions, then of course you might withhold some of that information if you don't think that it's actually helpful for the context that you're currently in. And so I think that we should be advancing both of these together, because advancing privacy can actually help advance public health as a goal or as an outcome as well.
Kia ora. Now, Tahu, you mentioned earlier your role with Te Manararaunga, Māori data sovereignty movement, but also Indigenous data sovereignty. And there was an important point that you've raised twice now about the definition of privacy in regards to the individual, the rights of the individual. There is also this very important layer around the collective. Could you please just tell us all, what are your thoughts on that, and what are the considerations that the Office of the Privacy Commission need to think about in regards to the application of law and the application of our awareness, broadening that scope of the rights of a collective and an individual?
Yeah, it's such a tricky area because we're doing a research program at the moment called Tikanga and Technology, which is a 4-year program, and we have a really interdisciplinary team. So we've got a former privacy commissioner from the state of Victoria in there who's a legal specialist in privacy. We've got people who are anthropologists and they specialise in mātauranga Māori. We've got someone who's a kind of an authority on human rights and privacy. And I think we really do need these multiple ways of looking and seeing privacy to really sort of craft an approach which is really fit for purpose for a rapidly evolving environment. Now, there's been a number of, I think, instances and the sort of examples given in the previous panel, but also in the talks about where the language of the individual is being used, but actually what they're talking about is the attributes that an individual might have that classify them as part of a group which is actually seen as desirable or undesirable. Whether they're being seen as the right tenant, whether they're being seen as a group who may be at a higher risk because of their particular characteristics. And so they sort of get shoehorned into a language of individuals, but actually, as a person who comes from a group that has been disproportionately surveilled, and there's a lot of evidence around that, often people from the dominant group are seen as individuals, but people from minority groups are seen as group members. And that informs decision making and informs the way in which data are collected, and which data are understood, and which data are acted on. So not attending to that, particularly in the context of amplified power to link, integrate, segment data into groups. And for the most part, the data aggregators and the data analysers are interested in groups, not really individuals. And even in the context of COVID, yes, sure, it might be individuals, but then it quickly becomes the context, quickly becomes the bubbles, quickly becomes the households, quickly becomes the workplace. The interconnections are undeniable. And so if we continue to focus simply on this sort of siloed approach of the individual, are we missing the woods for the trees? Now, in terms of what examples might we look to, we've done a fairly extensive literature review of and we couldn't find any example of a regulatory environment which spoke explicitly to collective privacy. So it's not just a blind spot here in Aotearoa at all, it's a global blind spot. And the places where we do see some pretty solid foundations for reimagining what this might look like are actually in Indigenous cultures which are inherently collectivists, which have intergenerational tikanga and kawa, which are sort of principles and protocols for how to keep things in balance, basically. And yes, they may not have been translated into formal legal regulatory environments, but the foundations for the thinking are there. So what we're interested in is how can we take that advantage that we have here in Aotearoa, not take, that's a very extractivist, how can we learn from that and start to provide guidance that might open up the understanding of privacy in a way which is productive and which is future-looking, as I think we need to look in the future. We can get stuck in the present and not look to the future, and I think that would be to our peril.
So we've got some excellent examples here in Aotearoa of collectivist thinking to help texture and advise and support broadening the scope around privacy here in Aotearoa. So that's a really important point there, John, for you and your team, to see, well, what does this look like in regards to the regulatory framework that has been established within the OPC, and are there elements that need to be added into it? I would say yes, but that's just me as MC today, and I can say that because I've got the microphone. But I do feel that it is very important, and completely agree with Tahu, the considerations and also the gems and jewels that can be brought from Indigenous knowledge and applied in this particular context for privacy, but also protecting the rights of the individual, but also all of us as New Zealanders in community.
Could I just comment on something? Sorry to interrupt.
No, go.
I think it's a really good point. The government security classifications for information, which are unclassified, in confidence, etc. When we reviewed it in the context of health, individual health information, we couldn't get a situation where we would go above essentially in confidence, I think. But when we aggregated the data, it went up another level because when you look at aggregated data, and this is not a privacy thing, but I guess it supports your view, the aggregated story about data could actually negatively impact the economy of New Zealand. And so it reaches a much higher threshold in terms of classification. And I think, to your point about when you take individual data, yes, it's important to the individual that's private, but if you take a collective view of it, then it could tell a story that you need to protect. So I think it's a really good point, and I don't know if we have a framework that looks at that, but certainly for security we do.
Yeah, and it's also very slippery because people, I think, comfortable, they understand intuitively the idea of defined groups. So you might belong to this group, or you might belong to an iwi, or there's sort of a socially identified group that people have a sense of consciousness of being part of. But increasingly, the slipperiness is where people are sort of sorted into groups that they have no knowledge of. That they have no power to influence. So, one classic example that I can think of a couple of years ago was this big piece of work that was done basically trying to anticipate, trying to model the lifetime costs of children of incarcerated parents. So these children don't know that they're being tagged as children of incarcerated parents, and they carry a great fiscal liability and risk to the state. So do they have to be? Do you have to be conscious of being a member of that group in order to have your dignity upheld? And the disparate impacts of the decision making that uses that evidence to make decisions about points of intervention. Of course, that impacts on them as individuals. So, it's a lot more slipperier than sort of how it's being positioned, I think, and then thinking about the way in which people are sorted into these groups without their knowledge and how that influences action and their disadvantage that can actually accrue to them. That's all wrapped up in privacy, I think.
I just want to chip in very briefly. In my conversations with people about Indigenous data sovereignty and Māori data sovereignty, I think when I'm talking to non-Māori, a lot of them are a bit wary or scared of it because they don't really know or understand what it is. And I think that when you actually go and look at it and you really read about it and you learn about the principles, a lot of them you will see are actually very much applicable to everyone. If you think about rangatiratanga and people having more control over their data, sign me up. Like, I absolutely want that, right? And
we'll make you a member.
Yeah, and if you look at manakitanga and you're thinking about, well, actually, the people whose data we are using, maybe we should think about how using that data is going to affect them. Like, why is that not in all of the terms and conditions? That should be there. That should be a given. So if you are, interested in learning more about Māori data sovereignty, I can recommend a chapter that was written by Tahu and her colleagues, Donna Cormack and Chris Cormack, in a book called Shouting Zeros and Ones.
Which he's editor of.
Yeah. People are laughing because I'm the editor, but chapter 2, good chapter.
You've definitely got honorary membership.
Shayne, of course, alongside all of the responsibilities that you had, there was also a consistent responsibility brought to the Ministry of Health and the ministers on a regular, and that is the role of government and its responsibility as a Te Tiriti partner. Now, with that, the Privacy Act seems to have a level of silence around Te Tiriti But in your particular role, how did your agency aim to uphold its roles and responsibilities as a Te Tiriti partner in regards to the rolling out of all these activities around COVID-19?
Oh, it's a tricky question. I mean, we have a directorate within the Ministry of Health that's responsible for Māori health, so we had them pretty actively involved as a team through pretty much all of the process of the work that we did. I guess for me, we're not specialists in this at all as a team. We're just technical people who get on and do stuff. So for me, it was what are the questions that we should be asking? What are the things that we need to take care of? What are the things that we need to do? I don't know whether it answers the question specifically, but for me and for the team personally, we had huge learnings out of the trial of the COVID card that we did in Aotearoa. And a big lesson for me, I have to say, was understanding the different perspectives on trust. And so we are very excited about our digital app, you know, and we've got essentially we've got a card that uses similar sorts of technology that, you know, certain people were pushing as the solution. But we went into it genuinely. We went in to understand the value of that card. And around about the time that the trial was finishing, we were also releasing the Bluetooth functionality on the app. And the question that was asked of me was, well, you've done a co-design process and a co-production process around the card in Rotorua. What's your thinking around the Bluetooth app? And I said, well, I mean, the reason we did it in Rotorua was basically for participation, was actually to understand how we would get people to participate in the trial. How would we understand whether people would participate on an ongoing basis? And we've got 2.x million people using this thing, so we're just going to turn it on. And that was the way I looked at it. And what I got feedback to me was, well, how do you think the people feel who've gone through the trial of the card about that? Because the question could be that you celebrate Bluetooth on the phone, you downplay the card. Were you ever serious? Were you ever actually committed to supporting local, the digitally excluded population who either chose to be excluded or were excluded for reasons of circumstance? And, you know, I had to reflect on that and think, you know, we don't always come with the right perspective, and we probably never will unless we engage with our Māori partners and get that perspective. So that's what we try to do through the process. And for me, it's just a learning experience, and we've just got to get better at it. And can I just say to your point, Andrew, one of the reasons we're not very good at things like having the conversation around Māori data governance is because we are not sure how to approach it, and we are scared that we might not get what we want to do. And the other lesson for me is that you will. It's about the conversation. It's you know, it's an and you have to do it. So I think we've learned a lot, and there's more that we can do. You know, I don't know if people know, but when Ashley came in, there was no Māori Health Directorate. It had gone. It's a thing of the history in the Ministry of Health. So we've got a strong Māori Health Directorate, and they are very active inside the ministry, and they provide good guidance and they provide good connection out into the community, and we value working with them.
I think there's a really important point there around, rather than engagement and partnership being what I'd say a hoha or a troublesome process, then in fact it's actually a significant value add. And I'll say a significant value add because the level of thinking and consideration and care that Māori practitioners bring to a decision-making table is considerable. Because not only are we having to think of ourselves and the safety of our own families, but we're always consistently thinking about our elders, our most vulnerable members of our community, our children. And when you have that plus a series of core values that influence your thinking, that is only going to add value to the dialogue, the decision making, and also careful consideration around not only how will this impact Māori, but actually everyone. We're always thinking about everyone, and I think that's one of the opportunities for growing the scope, is that this thinking, these frameworks, are actually considerate of all things, from the stars to the earth and everything in between. So it's a real beautiful opportunity for learning and development. Now, Andrew, I just wanted to also ask you a few questions about surveillance.
Sure.
Because, again, that tricky part of managing safety, public good, and also government over-intervention in our lives, what kind of approaches to data privacy do you feel are needed to help build this trust and reduce risk, especially in regards to the office of this office here?
Yeah, I mean, trust is a really difficult, it's always a really thorny question, right? I was involved in a lot of trying to get people to use NZ COVID Tracer, sort of middle to late of last year, and in engagement with Māori groups, for example, what I heard was, well, it's not that we don't trust the Ministry of Health per se, it's that we just don't trust the government to have our data, because that data has been systematically used against us for many, many, many years. And we see this as just being one further step. And that's not to speak for all Māori, but that, there are people that I was talking to who certainly held that view. And when that is the position that people are coming from, a mass advertising campaign isn't going to do anything. And Ashley Bloomfield standing up at a 1 p.m. press conference saying we all need to use the app, unfortunately isn't going to move the needle on trust on that. And so ultimately, the way that a government agency or government as a whole builds trust is through repeated assurances, but also repeated demonstrations that they are trusted entities to hold and use data. And that's a heavy burden for every government agency, because if anyone screws up, unfortunately it affects everyone, because people don't view the individual government agencies as individual government agencies, they just view the government as an entity. And that is where I do think that we need to move towards broader standards and broader rules that cover all government agencies, rather than relying on every agency to have its own privacy officer and to figure it out for themselves. If the Office of the Privacy Commissioner can have more weight in setting how all agencies act, then I think that gives us a bit more hope for the future.
Kia ora. A last question before we start to take some questions from Slido and also from the floor. And I'll start with you, Tahu. What might be some distinctive aspects of an Aotearoa approach to privacy, or data privacy specifically? And we'll start with you and we'll go through the group.
Okay, so maybe two aspects. And one sort of loops around back to the treaty. So it's our founding document. A lot of people don't really perhaps understand what it means beyond being some sort of abstract thing. But I suppose in the context of data, what it offers is the opportunity for more self-determining approaches, whether we think about self-determining approaches as individuals or collectives. So with Ministry of Health and other government agencies, there's obviously a much higher bar now to meet around stewardship of data and kaitiakitanga. But I think sometimes we get too hung up, and as someone who's often called on to advise government agencies on how they should do it better, sometimes I think we get too hung up on thinking about the relational space where Te Ao Māori and the government come together as treaty partners. And what that does is it misses out the private sector, which is a huge part of the digital environment. But what it also does is it means that we don't get investment in Māori controlled data infrastructure. And actually, I think one of the important learnings that came out from COVID was the way in which Māori communities, iwi and hapu, were able to respond really quickly and really effectively in the context of the pandemic. I mean, I live in Ngāroa Wāhia, Waikato Tainui, that's one of their flagship towns, and the rapidity and effectiveness with which that community response rolled out was phenomenal. And yet they did that without any government investment in their community-controlled data infrastructure. So even though it was an effective response, there were inefficiencies, there was imperfect information, and for ongoing pandemics and crises in the future, if we actually had a more decentralised, distributed model, which is not the sort of top-down government agencies act, but actually one that's much more nimble and distributed and invested in infrastructure in that way, I think we'll see quite different responses in the future. So I do think that that's one of our distinctive elements, is that we can do things differently by using the foundations that we already have to operationalise them in a different way, and that in turn should also lead to different sort of investment mechanisms, I think. The other distinctive aspect, I think, of Aotearoa is we can, that number 8 wire fencing sort of mentality where you just sort of like jack something up in your garage and kind of like see if it works or doesn't. Like, I don't think we are very digitally advanced. I don't think we need to be constrained by what everyone else in the world is doing. And so if we, one of the things that's been brought up earlier today was around offshoring of data. And most government agencies now are offshoring data, and there seems to be this mentality that we sort of lack the maturity in our own infrastructure to be able to, there's kind of two arguments for offshoring. One is that we don't have the sort of maturity, so we can't sort of guarantee the security in the way that some of the big operators can, and the other one is sort of like, economic rationality, and that it's cheaper to go and put it offshore. And I think they're really short-sighted sort of responses, and we actually need to give a lot more scrutiny to sort of what our technical solutions are as well, and maybe we need to invest in our own domestic infrastructure as well, instead of thinking, we're just going to do this and then we're going to offshore the rest. I think that's incredibly short-sighted. So there's a lot of opportunity, but I don't think they're being realised at the moment.
Awesome. Kia ora. Andrew, what are your thoughts? What would make a distinctive aspect, what might be the distinctive aspects of an Aotearoa approach to data privacy?
Yeah, I think I might be a little naive. 29-year-old still has a gleam in his eye, has hope for the world.
It'll be 29.
I think that New Zealand has a role to play in leading in this space. I don't think we have to wait for Europe and to watch how the GDPR rolls out and then copy-paste the bits that work. I don't think we need to wait for others to try things out before we just say, we put our foot down and say, we have a population of 5 million and we want to protect them. And so I think there are principles that come from Māori data sovereignty and Indigenous data sovereignty that can be applied with New Zealand as a lead, because we are probably further ahead on that journey than most other countries in the world. I think that would be great if everybody had more control over their own data, and if we had the right regulations and rules and cultural settings and private sector buy-in and all that would enable that to happen. I think that that's where we could show to the world that actually that model can work. It doesn't have to cost, the price of innovation. Doesn't have to cost businesses anything to actually make that happen. All it requires is a change in policy and a change in mentality. And I'm saying that like it's nothing, but obviously it's a long journey to achieve that.
Now, Shayne, reflecting on what you've shared with us this morning, it sounds as if Ashley trusted you to get on with the job. You just said, these are the outcomes that I need, and I need to trust in your leadership to do what's required. It also sounded as if you did the same with your team. So you oversaw a series of experiments, ideas, innovations to help, again, protect all New Zealanders in regards to the threat of COVID-19. For you, with your Ministry of Health hat on, how do you see Aotearoa or an Aotearoa distinction in protecting our privacy and our approach to caring for the privacy of all of us?
So I guess there's a couple of things for me at the moment. One is more general and not just privacy related, but we would like to leverage, I guess you could call it, the vaccination program as a potential way of capturing iwi affiliation data. And the conversation that we've had is, why could we not use this to produce an asset for Māori? Why do we need to produce something that we own and that we control as a government? Why could we not produce an asset and an infrastructure and a capability that we can hand to Māori that they can then use on an ongoing basis? And I would like to see that considered, for a number of things, because I just think it's a different way to look at it. We typically capture and hold and control and give, Māori right to their data. It's actually their data. So I think, and that then allows them to manage that and privacy and so forth. The other one for me is, I really want to, in the health context, I want to put control in the hands of the individual. I'd like individuals, and so we're doing some work at the moment around digital identity, and digital identity is absolutely heading down a decentralised path. And, you know, I think there'll always be a bit of a mix of the decentralised and centralised model. That's just the reality of how it's going to need to work. But if you can put the power in the hands of the individuals, if you've got a verified identity and an app that lets you control information, I think that'll be very powerful for the individuals. And the other one for me is just that you know who's seeing your data, you know who's been in and looking at your information. To make that highly, highly visible will be an important feature, I think, of the system going forward. It will certainly help with trust.
Awesome. Kia ora. Hey, look, now that we've come to this particular junction of the kōrero, thank you all for sharing some really important insights. I loved hearing the potential of decentralising data and some quite deep considerations around the use, storage and enablement of data sovereignty from an Indigenous perspective. Thank you, Andrew, for also highlighting the balances that we need to be considerate of in regards to surveilling, but also keeping New Zealanders safe, and that they should actually go hand in hand, rather than one kind of running off and then we're going backwards and saying, oh, let's think about how this might actually affect individuals and their ability for freedom. And also, Shayne, thank you so much for being open to hearing the needs of your community that you're serving, especially in Rotorua, and actually having to press pause and going, actually, I didn't consider that, I didn't think about that, but perhaps I might need to think and approach and behave differently in order for a better outcome. So that's really awesome to hear as a leader inside the ministry of your openness and willingness for change. So I'd like to open the floor up for the next 3 to 4 minutes. Does anyone have a burning question that you would like to pose to the panel? Kia ora. Oh, Charles.
Yeah, my question is, actually, I'd really be keen to know how successful the Bluetooth tracing on the New Zealand COVID app is.
Very good question. So we, at the moment, have about 1.3 million that have enabled it. We know that somebody's enabled, but we have no idea who has enabled it. I just need to stress the point about that. It is very private. You probably couldn't get a more private application. The truth is, we just don't have enough cases in New Zealand to actually know how effective it is. However, overseas where they do and where they're using the same framework, there's definitely evidence that it's been very supportive of contact tracing. We have used it a few times. It has been helpful, but not enough for us to have a good evidence base.
Yeah, I think the two key metrics, so one is completeness of finding all of the possible contacts. I think the evidence suggests so far from what we're hearing is that you might not find more contacts than you otherwise might find through a manual contact tracing process, but the second metric is speed. And because COVID-19 is such a highly transmissible disease, you really want to notify contacts really, really quickly that they need to isolate rather than waiting for the manual system. And so that's where the benefit is.
Great, I had a question at the back here. Sir, just here on my left. Yep.
My question for all the panelists is really about the EU affiliation suggestion that you add that kind of data to some kind of register. I just sound a note of caution that in the 1930s, the Netherlands, I think people might have heard that they had this very advanced social kind of register with family information about their relatives, genealogy, all of that kind of information was collected so that better social services could be delivered. And of course, once the Nazis took over the Netherlands, that allowed very easy tracing of the Jewish population. And so one purpose led to a far more sinister purpose. So there's always a note of caution there. What safeguards do you think would need to be introduced so that people would trust that this was only going to be used for benevolent purposes and not less benevolent?
I mean, we have that history in New Zealand as well with the Māori census, right? And how that then led to dispossession of land, right? So we don't need to go to the Netherlands to find a negative example of that, right?
So we are working with Māori at the moment. It will essentially be co-designed and co-produced with them. I can say now it will not be stored in a current national system that we have today. So it needs to be kept separate. I guess the point I'm trying to make is it will be separate and it will be given to Māori and it will be in the control of Māori. That's what I would like to see. I think, you know, there will be reasons why it's required, and Statistics New Zealand aren't here to speak for their wants and needs, but it's not. It's actually the reason it's come actually up is because we were asked to look at the opportunity as part of the vaccine program. So it's using the fact that we'll have a lot of people getting vaccinated as an opportunity to capture some information for Māori, but we have to be very cautious about how we go about that, what the process is. You know, there'll be a lot of careful thought given into it, and we are, I think, being deliberately cautious about the process.
Yeah, I mean, it's a great question, and I was actually on a webinar a couple of weeks ago that was jointly held by the Norwegian Institute for Human Rights and the Sami Parliament, and it speaks to the very point that you raise and the misuse of that data to identify Sami during World War II, and subjugate them to all sorts of horrendous experiences. And so there's a great deal of mistrust in that community about the state having ownership of Sami data. But at the same time, the terrain has changed, and self-determining Sami communities and authorities want to have the data so they can act in an informed way. And so it sort of brings us back to the earlier point I guess I made within Indigenous data sovereignty, which at the heart of that is shifting the locus of power. So we can't just return to or want to exponentially expand the collection of data without having the oversight and without asking the question, why are we doing this? Who's this for? Who's designing it? Where's the data going to go? All those questions are absolutely critical to any activity that is going to expand the opportunity for surveillance and data risk and data harm. And so here I feel like the system, in terms of official statistics anyway, we've been collecting Māori data. I've written about this at length, about that sort of trajectory of the state collection of Māori identifiers as part of the very fabric of the colonial nation state, and how data was absolutely fundamental to that, and including the dispossession of land. But the thing that I suppose is really sort of driving the appetite for more data from Māori communities and from the iwi Chairs Forum, which Shayne is alluding to, is that the necessary conditions for that is who controls it. So no one's saying go and collect more data on us and do with it what you will. The time for that is long past. So it's very much a conditional license, which is you collect the data because you have an obligation to collect the data, and you've got a crap load of money to do it with, to do it properly. And then when you've collected the data that's relevant to us, we want to see a system in place where there's clear oversight, clear accountability, and which may transition towards a very different system, and that system might involve some sort of integration between government collected data and iwi controlled registers, for example, and so you don't need to collect identifiers anymore because the communities themselves provide the identifiers. So there's all sorts of opportunity for doing things differently and chucking stuff out that doesn't work.
Kia ora. E hoa. What a brilliant panel, some excellent thinking, some excellent challenges for growth, broadening our scope, broadening our understanding, but also aligns really beautifully with our forum's theme, which is privacy is precious. Our privacy is precious, and therefore thank you all for sharing your insight, your whakaaro, your thinking, to help us all, I hope, take pieces of this away and take action with it. Affirmative, useful, helpful action as well. So, homaite paki paki. Thank you. Kia ora, everyone. Sorry, most importantly, lots of food for thought for the Office of the Privacy Commissioner to really think quite broadly about the application of these aspects across Indigenous data sovereignty, Māori data sovereignty, health technology, and also surveillance. So without further ado, We have now come to the final part of our forum, which is the closing remarks from John. How are you all feeling? You feeling okay? Big day, big day. And thank you all for having the patience, the care, the consideration to sit through all of these presentations. I hope they have been helpful to you. I hope it's given you an insight into where privacy and the reforms of privacy is heading for Aotearoa, and also where we might go to next. Finally, just as a reminder for those of you that put some questions through in the Slido, don't fear that your questions have been wasted. We will find a way to get some answers back to you. So kia ora, John, if you could please come and take the stage, the taumata, and farewell us for this afternoon.
Kia ora. Thank you so much for doing such a wonderful job stewarding us through our session today. It's been wonderful. Thank you, Kaye-Maree. I don't know about you, but I found that today every single session to contain something truly inspirational. And it's not often I go to a privacy conference and can often, can honestly say that. To see on the stage the different sides of the tenancy market interacting and agreeing and helping us with our mahi was inspirational. Certainly I thought what Ashley had to say I found quite moving and inspirational in terms of his approach to leadership. And I've learned from Ashley, the ability to show that humility, that vulnerability, to be open and transparent and recognise where we've made mistakes or where we don't have capability. And we certainly at our office find ourselves in that position in relation to much of the kōrero in the last session and our ability to engage with Māori and to recognise the very important Te Ao Māori dimension that we need to bring to our work, which I touched on briefly in my opening remarks. I remember in 1995 attending a Privacy Commissioners Conference in Denmark, in Copenhagen. It was this beautiful palace with gilt ceilings and crystal chandeliers. And at question time, I sort of gingerly took the floor and said, well, what do you think about this idea of communal or collective privacy? Is there some place for recognising privacy rights, for example, with Indigenous people? Well, I was met with silence and stony faces, and it was kind of embarrassing to the point where I sort of flushed and just had to sit down again, because it had never occurred to anybody in that context that this Eurocentric approach to data protection could accommodate different cultural practices. I think it can and it must, and I think that we have potential here to lead in this area. But our leadership in the Office of the Privacy Commissioner requires first for us to recognise that we don't know and we need your help. So thank you to Tahu, thank you to Kaye-Maree for bringing that perspective to us, to all the speakers. The other thing that I've learned about leadership is that you've got to try and inspire, to multiply your message, to amplify the message through the agency of others, like Ashley told us, like Shayne told us. You appoint people, you get them to work for you, and you trust them to do it. And that means you can be far more powerful. So we need to lead by working through networks. We're working through you. I'm using you. You are leaders. So I want you to take what you've got from today back into your communities, into your businesses, into your departments, and to continue to lead and inspire people about the importance of privacy and the benefits and the fundamental and inherent rights that people have to have their personal information respected. So I rely on you. I want to thank all the panellists and speakers who have inspired us all today. It's been wonderful. I won't name them all, but I also want to particularly mention my comms team, who've put this program together and who've arranged it, organised it. They've greeted you at the door. They've taken your money. They've written speeches and notes and made arrangements. So that's Alex and Charles Faley, whose last day with us today. Graydon, Joe Hughes is my new Assistant Commissioner, Strategy and Insights, who now leads that team. Annabelle, who until recently was managing that team and got a long way along this pathway to the forum before accepting an exciting opportunity on the dark side. And I want to thank, obviously, Julie and Sharon, who supported the team, and Donna in bringing this together. But thank you all for coming and for your ongoing interest and enthusiasm and for helping us in our mission to ensure that people know that privacy is precious. Ngā mihi mahana, kia koutou katoa, ka kite anō, kia pai tōrā. Thank you. Goodbye.
I have to say, you're pretty cool, John. It's a pretty cool commissioner, and I love the way that you shape and think and acknowledge everybody in this space. So thank you so much for holding this important responsibility on behalf of all of us. So we did open today with a karakia. That karakia just connected us to the winds and the water and waking us up. So before I let you all disappear today, a couple of things. Please stay connected via the website. We will get some communications out to you about the proceedings of today. I also can imagine that today has also been filmed, and so elements of today will also be available so that you can share that with your colleagues as well. Nō reira, e hoa mā, ngā mihi nunui kia koutou. Ko tai mai, ki tēnei kaupapa. I'll just finish off with a blessing and I'll do a translation for you all as well. Kia hora te marino, kia whakapapa paunamu te moana, kia tere ka rohi I mua I tau huarahi. May calm be spread around you, may the sea glisten like greenstone, and the shimmer of summer dance across your path, even though we are in winter. Mauri ora. Take care, enjoy, have a lovely weekend.